Welcome back to Born for This Stories, where we speak the truths no one told us, so you don't have to carry this alone. I remember the day our surgeon handed me a post-op sheet and I saw the words hyperbaric oxygen therapy on it. And I thought, okay, where do I find that? How do we pay for it? Can our son even tolerate that at 6 months old? Nobody walked me through it. Nobody said, here's what to expect. Here's what it does. Here's how to find it. And so I did what every medical mama does. I started researching it. Today's episode is the conversation I wish I had. I'm sitting down with Dr. Jason Saunders, a doctor of chiropractic and PhD with 21 years in functional medicine and hyperbaric oxygen therapy and the owner of HBOT USA. We're going to talk about hyperbaric oxygen in a way that actually makes sense for the parents in recovery mode who just wants to understand what's going on to help their child and what is able to help them heal. He believes that labels do not dictate outcomes, that your child's body has the capacity to heal, and that when you create the right environment, when you move towards sufficiency instead of depletion, the body knows what to do. Dr. Saunders, welcome to Born for This Stories. We definitely have been waiting to have this conversation with you for as long as I can remember, because you are very much a big impact to our story and journey. And so I'm thankful that you're here. So why don't we, before we begin, why don't you just tell the listeners a little bit about who you are, give us like what you're doing, how you got into this space, and then we'll start from there.
Sure. Okay. Well, I've been in practice for a little over 20 years. My own sort of hyperbaric story, which, maybe I'm not even sure if you guys know, but
Mm-mm.
it was a journey for me personally, not really that I was ever going to use it in practice, but I had nerve damage. I herniated a disc in my back and basically was left with nerve damage, drop foot in my right leg.
Wow.
Uh, 18 months later, no recovery. Like the back pain got better, and I was doing all the things. Like I'm a chiropractor by trade. My wife's a chiropractor. My background was exercise physiology and
Yeah.
nutrition. So like all the anti-inflammatory things you can think of, all the rehab and recovery that you can think of. Um, but so felt better, but just couldn't shake the nerve damage, and came across hyperbaric literally by accident. Tried it more out of curiosity than the idea that I thought it would actually help me. And really, after 1.5 hour session, it was the first time I had even I felt like pins and needles in my
Yeah.
foot. That was the first time I felt my foot in like a year and a half. And so I bought one, brought it home, treated myself, took a few months, and I had a full recovery. And so I still didn't think I was going to use it for patients. It was really just like I have this tool now for me whenever
Yeah.
I might need it. But as time went on, I'd have patients that just weren't responding properly, or God, maybe the oxygen would help them. I don't know. And
Yeah.
so very slowly, I started using it in additional protocols, finding it literally life-changing for most people each time. And so it became, a big part of what we were using in the office. Fast forward a couple decades, now I've done some research in it. I've written about it. I've written
Yeah.
articles, books. Went back for a PhD in molecular biology. All of my research was done on hyperbaric. So, yeah, I spend a lot of time in that world right now.
Cool. Well, thank you. That is helping so many people by doing all that research and just, ironically enough, you stumbled upon it. So that's very helpful. So I know I had sent like a pre-interview sheet and had kind of went back and forth with a couple of questions, and you had written something that like stood out to me, and you said that labels do not dictate outcomes.
Hmm.
So you want to speak a little bit about that?
Sure. I mean, I feel like something goes wrong with somebody's health, and very quickly we want like the diagnosis in order to essentially pinpoint the cause or pinpoint the category of whatever it is that I'm dealing with, and immediately start going down a road. But um, I think a lot of times, like even, I mean, pick a diagnosis, but
Hmm.
10 people with the same diagnosis may have 10 different reasons why they got that diagnosis. They
Yeah.
may all respond to the same therapy in 10 different ways.
Yeah.
Um, so, I'm not discounting the need to go through a diagnostic process.
Sure.
I'm just saying that I feel uh, every case we've ever worked on with hyperbarics or other, there needs to be more thought that goes into it.
Yeah.
Even when I teach hyperbarics, like I tell people general protocols, but I'm like, don't follow this protocol. Understand the patient, understand what their needs are. How severe is it? How long have they had it? How well do they tolerate the therapy? And then build that person's protocol
Yeah.
versus sticking everybody with the same diagnosis into the same sort of package. Like
Sure.
my experience says that medicine doesn't work like that. My experience says we need to be more thoughtful about every case that comes into our office, and we need to be really thoughtful about how we develop protocols initially, and then going into and tweaking and modifying things as needed based on a person's response.
Yeah.
Um, but in my office anyway, like we don't treat diagnoses, we treat people.
Yeah.
And so every protocol is based on that person, not based on their diagnostic code.
Yes. Yeah. I think that's important.
So with that, you treated pretty pretty severe nerve damage. You had a drop foot. We used it, and I think not that I'm extremely educated on how this works, but we used it for like blood vessel growth and healing.
Mhm.
Where does the jurisdiction, for lack of a better term, begin and end for hyperbaric treatments?
So, hyperbaric, first of all, hyperbaric is a single word that describes a pretty wide range of therapy, meaning everything from lower pressure, like what you would find in a soft chamber, which would be about 1.3 atmospheres.
Mhm.
That's about 30% of an increase in atmospheric pressure compared to sea level, all the way up to 3 atmospheres, which is literally 3 times the pressure of the atmosphere. And then everything from breathing air, which is 21% oxygen, all the way to breathing 100% oxygen. So those are two main variables. What pressure are we going to? What percentage of oxygen are we breathing? And then there's the larger variable, which is time. How frequently are we going? How long are each session? And for how long are we going to do sessions for? All of that gets mixed together to kind of develop and build out that full protocol.
Yeah.
And different responses will occur from different programming. So, uh, maybe the top 10 to 12 things someone could expect from hyperbaric, like lowered inflammation,
Mhm.
new blood vessel growth, other growth factors like for soft tissue, bone, ligaments, skin, um, stem cell mobilization, immune system boosting, helping to kill certain bacteria, depending on if they're anaerobic bacteria, reducing swelling and edema, increasing cellular energy. So, you know, what does hyperbaric do? Hyperbaric does really one thing. It delivers a higher level of oxygen than what anyone can get exposed to any other way. But with that higher level of oxygen, there's about 10 to 12 pathways that get stimulated pretty much for everybody. So even though you weren't necessarily using it for nerve damage, the signals that I got benefit from and the signals that you got benefit from were all stimulated,
Yeah.
right? But um, I wasn't necessarily in need of angiogenesis is the term for new blood vessel growth. Like I wasn't necessarily in need of new blood vessel growth, but those signals were still activated in my body.
Yeah.
So it's kind of like anybody that goes in a chamber gets all of these pathways stimulated, but the ones that you need are the ones that you'll take notice to or really feel or see as an outcome to hyperbarics.
Yeah. I love
But
the way.
it is a pretty broad range of benefit.
Yeah, I like the way that you explain that because I never thought about it that way, that it would target, well, you would notice the ones that it needs to target, basically. And I think as we, bring awareness to this topic and bring this resource to different listeners and their kiddos and even, the care providers too. I mean, obviously you can use it. Like I went in with my son because he was 6 months old when we started this. Like I couldn't put him in there by
Right.
himself. And so, yeah, he very well could have had different benefits than I did at that time.
Right.
Yeah.
So are you recommending this as well for just health and wellness and just as a part, of your wellness routine?
Yeah, I mean, I think looking at oxygen almost as a nutrient,
Yeah.
you could say that, you know, let's use vitamin C as an example. Like you could have vitamin C deficiency and get really sick from that. That would be we would call that scurvy, right? So you want to make sure you're getting enough vitamin C not to have scurvy. You also want to make sure you have enough vitamin C for all the different things that vitamin C might do for you. But even if you were optimally dosed in vitamin C on a daily basis, you could have health challenges that force you to take even higher levels of vitamin C periodically. Maybe you got sick and you wanted to boost your immune system, or God forbid, cancer, and you're doing like high dose vitamin C IV, just as some examples. Well, oxygen also, like to have lower levels of oxygen and post-surgically, somebody could become hypoxic. So
Mhm.
making sure you don't become hypoxic, you boost the oxygen levels. In my case, it was inflammation that was creating the nerve damage, lowering the inflammation low enough so that my body can oxygenate and start to heal. So we want to get this like normal level of oxygen on a regular basis, but even if you are, you still might kind of boost your oxygen periodically throughout your life, even if you're not complaining about something.
Yeah.
And so using oxygen in mild doses, let's say, for health and wellness, or really high doses, God forbid there was, pretty serious illness, would be an appropriate way to, I think, view the tool. I've had that chamber for 20 years, the one that I used for my nerve damage.
Yeah.
And, there's times I'm using it because I do have other issues over these years, and there's times I'm using it just more for like maintenance and general well-being. So 100%, yes.
Yeah.
Cool.
Love that. Love that. I know you chatted a little bit about the difference between a hard shell and a soft shell, like the different pressure and stuff that they do. Do you also want to go a little bit more into if someone couldn't get to a hard shell unit, right? Like they didn't have one around them or they didn't have access to it. Will the soft shell still be beneficial if they are recommended to do the hard shell?
Most of the time, the answer is yes. And most of the time, the difference would be time.
Yeah.
In other words, like for my nerve issue, I used 1.3 soft
Hmm.
chamber. I did not use oxygen. Why didn't I use oxygen? Because I didn't know anything about hyperbarics.
Yeah.
And I got a soft chamber that had no oxygen and I still got better. It took about 6 months.
Hmm.
If I had that same issue today, I'd probably go a little bit deeper and I would use oxygen. And what
Yeah.
took me 6 months, I could probably do in 6 weeks.
Yeah.
So, if somebody came to my office, they're using they're choosing to come to my office. It's a huge, we were just talking about this, it's a huge time commitment.
Yeah.
And it's a huge financial commitment. So
Mhm.
I view my job as I need to give you a dose of oxygen that would get you the most result in the shortest period of time so
Yeah.
that I'm not wasting your money and I'm not wasting your time.
Yeah.
So I might use higher pressures in certain cases so that I get to that result faster. But to your point, if you don't have that as an option,
Hmm.
you can't get somewhere. I mean, it's growing rapidly, but there's still tons of communities that just don't have
Right.
a chamber locally. In many cases, you'd still get a same response. It's just going to take longer to get there.
Yeah. And I wanted to bring this up like in conversation too, because there are locations to us that are closer, but they didn't allow children inside the unit. Like they didn't do it until like they were, I think, maybe 12 years old. So, it's important to just, let people know that younger kids can utilize the units and like safety, obviously there's safety precautions and all that. Like we're not discrediting that. But if you are in a predicament or maybe there is one right up the street, but they don't let your kiddo in, there are some other options out there.
Yeah, I mean, if you have one up the street and they're not letting your kid in, tell them to call me,
Yeah, I love
and
that.
I
Yeah.
will gladly help them understand why it's completely. I mean, we treat newborns,
Yeah.
like there is not an age where oxygen is dangerous.
Yeah.
Now, again, you might modify the protocol because we're dealing
Yeah.
with a younger person, but it's not like Listen, if you go in an airplane, the kid is being exposed to pressure.
Hmm.
Oxygen is something our body uses every minute of every day.
Yeah.
So this isn't really a an intense therapy. It's modulating pressure a little bit. It's modulating oxygen a little bit. It's incredibly safe. Um, so, to not treat kids to me blows my mind. But, a lot of the training, like, we were saying earlier, I spend a lot of time in this world, most of which right now is training other people how to do hyperbarics.
Yeah.
And opening that door for pediatrics is a huge um, interest of mine because I know how difficult it is to really find, and
Yeah.
it's unfortunate.
Yeah, it is. I definitely agree with you there. And so it sounds like obviously you do training for individuals or doctors and professionals on how to use this. And is there some advice that you can give to our listeners regarding like how to know if they're with the right type of facility? Like, are there certain questions or is there like a protocol the doctor should do to make sure it's okay and safe for the person to be in hyperbaric? Because I know for example, for us, I went and of course we tried the hard shell first, and he was a neurologist, did a quick overview of me and my son, and at the time my son was 6 months old, and he said he was all good. He looked in his ears. He said all good to go, and we went in and we didn't even get far under pressure, and he's screaming and pulling at his ears, and so he missed that he had ear congestion going on. So just how do we know we're with a right provider and we're with the right person to do these procedures?
That's a tough one. I guess some questions would be like, have they been trained,
Mm.
and have
Yeah.
they maintained, like, are they current in all of their training?
Okay.
If they do they treat children? And if
Yeah.
so, like, is that a part of like a general part of their practice? In other words, like, um, in that same scenario, he could have not had ear congestion, but the same way, we have screaming infants on airplanes,
Yeah.
could be the same way we end up with aggravating, a small child's eustachian tube and tympanic membrane because we have to have techniques. We have to have um, a way to manage that pressure. Like, so if they're really young, saving a feeding time, like a nursing time for
Mhm.
the chamber, the same way we would often in an airplane.
Yeah.
If we're using a pacifier, even just that sucking motion helps with ear equalization. Um, Using earplug. I mean, there's a number of little techniques that we could be using,
Yeah.
and somebody who treats pediatrics regularly would be prepared for that. They would also pressurize the chamber much slower than if it was an adult alone,
Yeah.
right? So like
Great.
just knowing that like this person works with kids and kind of has a background and knowledge of how to manipulate their equipment to make sure that my child feels comfortable, is safe, and can do the treatment is important.
Yeah, for sure. And then when people are able to get the chambers for home, is there a training protocol that they should do, or how does that work?
I mean, there are. I mean, there's some of it's a little bit more than what most people need, but still having like some basic. So first of all, the manufacturers sometimes may offer some basic training. Um, we have a basic training program for like soft chamber use.
Cool. Very nice.
But yeah, I think that it's important to know, like, you could be doing it all right. You're doing it at home, everything's fine. All of a sudden, your child is sick, they're congested, and like, whoa, like they're screaming out of nowhere. I have
Yeah.
no idea why. Well,
Yeah.
when you're congested, your eustachian tubes are clogged, and whatever they were doing originally to equalize, they're struggling right now.
Hmm. Yeah.
Let's try to go slower. Let's try, or okay, we have to bail today, and we'll come back and try it again tomorrow.
Yeah.
You
Off
know.
the top of your mind, thinking about just like some common childhood like birth defects, and the top ones are like that we know of usually are like cleft palate, con heart stuff, club feet, all like just think about the different ones. Are there any contraindications that you could throw out there right away so parents can say, okay, well, maybe we can't go down that route?
So yeah, I mean, uh, generally, especially with like a moderate to severe cleft palate, that child won't be able to equalize their ears.
Mm, yeah,
So that for sure. Kind of everything else you mentioned, and for the most part, almost anything else I can think of, it should be fine. Although, if we're dealing especially with a really young child, like they're not going to be able to equalize on their own. So we need to either bottle feed or nurse or something where we're activating that sucking response
right.
during the pressurization process to really keep them pretty comfortable.
Yeah,
The other option is to have tubes put in their ears. Some kids with like recurrent ear infections may already have tubes in their ears.
yeah,
If you have tubes in your ears, which is, it's like, I'd hate to do it only for hyperbarics.
yeah,
It's really not a super invasive treatment, but if you have tubes in the ears, that creates a very tiny perforation in the tympanic membrane, and now equalization isn't even a conversation. Like you could just go in a chamber, it's not even, you wouldn't even know you're in a chamber.
oh yeah,
So
interesting.
that's one, like, again, it's still a procedure. It's pretty minimal, but
Yeah,
that could be something that like, oh, we couldn't do it. Now we could just do it, and it's not even a equalization's not even a conversation.
yeah. And it's go ahead.
Are there any major negative side effects or risks
To tubes or to hyperbaric?
to hyperbaric?
Um, there are things like, so yes, I mean anything that has potential benefit has potential risk, right?
Sure.
As I said before, we're talking pressure and oxygen, which are pretty benign. So like
Yeah,
the risks aren't really very high. Um, to name a few, oxygen toxicity is a thing. So even though oxygen is required for our body to function, and it's the main benefit of hyperbaric, too much of a good thing is still too much. In a soft chamber, oxygen toxicity is just about impossible. It just doesn't go to the pressures high enough to cause it. Um, Typically, like 2 atmospheres roughly is where oxygen toxicity becomes a conversation. Um, smaller children could have more risk. So as a result, like even in my office, we could go to higher pressure. We just often don't because we don't need to.
yeah,
And we're not looking to increase the risk of something like that.
right.
Um, Middle ear trauma from pressure changes is really the biggest thing, and that's really the equalization conversation. Everything else is really issues like if you have cataracts, that's generally a condition of older age. It could mature quicker. It won't cause cataracts, but if someone had cataracts, it could accelerate them. Um, Certain heart conditions, certain lung conditions, certain drugs that somebody's on, almost exclusively, these people have to be pretty compromised cardiovascularly for it to become an issue. But again, my opinion is if you're going to a clinic, that clinic should be ruling all of these kinds of things out.
Absolutely. Yeah,
And if you're doing a home chamber, you shouldn't be doing it on your own. Like you should still be working with somebody that could help understand any of those potential challenges
yeah,
and then help you work through that to be like, oh, hyperbaric is not for you, right?
yeah,
Unfortunately, there are people out there like you could go online, just buy a chamber. Next thing you know, you have one, like no instructions, no nothing. Like, boom, here it is.
yeah,
And I think that that's not good for the industry. I think that that's not great for the family. Like, if you don't know how to use it properly, if you don't even know if it was a good fit, if you don't even know if you're cleared or it's appropriate to use, certainly if you don't have the right protocol to follow, like
yeah,
what value does that chamber actually have? And so, I really think that it's a medical device. It does require some amount of consulting, let's just say. One, to make sure it's safe, and two, to make sure you get the most out of it.
yeah. And, just to remind listeners, like I consulted with you. I had scheduled on your calendar. And I was like, I'm going to talk to you and make sure that like we're in a good state. And I know what is a good protocol because when we did get our chamber, like we learned how to use it and learned how to set it up, but I had no idea what protocol to use or especially for our scenario. And I'm like, I could get in there for wellness like that I felt comfortable with. But anything beyond that, had no clue.
Right.
So do you still offer that service?
I do. Yeah,
Beautiful.
absolutely.
Yeah. And I would suggest too, like based on what you were saying, like if you're not sure, having a call with you prior to purchasing a unit, if you're consider purchasing one, maybe talk to you first to make sure that it's right.
Yeah. Well, make sure it's a good fit, make sure
Yeah.
it's even the right tool. And then, of
Yeah.
course, making sure, do you need oxygen? Do you not need oxygen? And then once you have it, what type of protocol should you follow? Like, again, I'm very sensitive to not waste anybody's money or time. And it's
Yeah.
like, if you're gonna, these things are not inexpensive.
Yeah. Yeah.
Um, it'd be a shame to have it and not get the result that you wanted because you didn't know the right program to follow. So yeah, 100%.
Yeah. For sure. For sure. So tread lightly if you're trying to buy a used one from Marketplace.
Yes.
Because you don't know anything about that. I did want to mention, I have to backtrack my thought here a little bit because it's been sitting on my brain. Well, I wanted to mention, and I know we've talked a little bit about it, but like, for example, when I had mentioned it to the facility that we were using for our son's surgery about doing a soft shell because we didn't have access to the hard shell, they were very like,
Dismissive.
yeah, very dismissive. Like, oh, well, that's not going to make a difference or do anything. Can you speak upon that a little bit? Because I want to empower people that like if they hear that as well, not that their provider is wrong, but maybe we still need to consider these other options.
Yeah, I mean, I think a lot of people just don't know.
Yeah.
I
Yeah.
hear that
Agreed.
all the time
Agreed.
today, even having done this for 20 years, like 20 years ago, I heard that a lot. Today,
Mhm.
I still hear it a lot.
Yeah.
Maybe a little less, but not a lot less. Um, as we said, a lot, especially if you talk to a clinic that's doing hard chambers, they're going to tell you soft chambers do nothing,
Yeah, for sure. I believe that.
unfortunately. Um, I don't know if that's like self-preservation or if that's really how they feel, but that was really one of the reasons I did the research that I did was like I get that question, I don't know, maybe 75 times a day. So I'm like,
Yeah.
somebody needs to answer this question, and nobody seems to act like there's a lot of debate in the industry, but all of the debate in the industry has just been emotionally driven, not data driven,
Yeah.
or
I see that.
driven by like, well, I offer soft chambers in my clinic, so I just tell people that they're good, or I offer hard chambers in my clinic, so I tell people soft chambers are bad.
Yeah.
Like that is not medicine.
Yeah.
And that's not good for the industry, and it's certainly not good for patients trying to gain access to the therapy. So that was really my driving force for wanting to do the research that I did. But, you know, is it the same? No. Is it going to take you longer? Yes.
Mhm.
Might it be the difference between having access to it or not? Then you got to do what you got to do,
Yeah.
you know? And like I said, I mean, I think what I was able to do with the soft chamber on my own, I could have done quicker, knowing what I now know.
Yeah.
But to say that it's not going to have an effect is it's just wrong,
Yeah.
you know.
Yeah.
Are there hard chambers available for home use?
There are, I really, I try to convince people not to do that.
Hmm.
Um, Mainly because, you were asking earlier about like the risks of hyperbaric. As the pressure goes up incrementally, the risks of hyperbaric go up exponentially.
Hmm.
And so, you know, I mean, I have a soft chamber in my house. I could have a hard chamber in my house. I happen to know what I'm doing, so
Yeah.
like I feel safe having a hard chamber in my house, but I still have a soft chamber in my house because that's all I really know that I need.
Yeah.
Um, most people just have this assumption that more is better, and it's just not. And to not have exponentially higher benefit for most people, yet have exponentially higher risk, like I just can't justify that as a decision, and I can't encourage that in most people that I talk to. Now, there are certain conditions, certain people, certain situations where like higher pressure is incredibly important. They have no option of getting access to higher pressure at a clinic, in which case having a higher pressure device at home is appropriate. But I'd say that's definitely less than 20% of the time, and probably considerably less than that.
Got it.
Gotcha.
Yeah, that's well said for sure. Do you have any stories like from your clinic of working with kiddos and seeing some really good changes? And I mean, just in general, it doesn't have to necessarily be with like a birth defect or anything like that, but what have you seen?
Yeah, I mean, we happen to treat a ton of kids. We see a lot of developmental delay. We see a lot of children on the spectrum.
Mm-hmm.
Um, we see children diagnosed with CP. Um, we've had a few that are like severely brain injured from like a birth trauma or even a near drowning.
Yeah.
Um, I mean, especially for children, in most cases, hyperbaric is like nothing short of a miracle.
Yeah.
Like, nobody could possibly imagine that a little bit of pressure and a little bit of oxygen could be this life altering in so many cases, like particularly brain related issues in a younger child. They respond. Now, listen, nothing is quick in brain injury and nothing is quick in like chronic illness in general,
Yeah.
but a child with a brain injury can respond relatively quickly to hyperbaric. We've had you know, children that are essentially in vegetative states, regain consciousness, regain function. Um, we've had children diagnosed with CP that regain almost completely normal function. Um, we've had, nonverbal children on the spectrum speak their first words, tell their mother that they love them for the first time in our office. We've had children, with spastic paralysis from like a stroke at birth, like regain full mobility of their extremity. You, it's even crazy to think this, but like you almost begin to expect miracles because of how frequent you see them.
Yeah.
You're like, medicine's like, I've given up. There's nothing we can do for this kid. Like this is as good as it's going to get. They'll get older, they'll clear some of this developmental, or they'll learn how to compensate over time, but like this is how it is. And then they're back in school in normal classes. I mean, I had a call with a dad yesterday, and we're redoing some testing with this child that he's been under our care for like almost 3 years, right? So he started when he was 7, he's 10. um, Pretty severe autism with some other developmental challenges. I mean, this kid is like he's in like normal school, normal classes. He's now in advanced English, advanced math. All
Wow.
of the behavioral issues are gone. Like this dad was going on and on about just like we started this. He always would say something like, "I just want to give my child the best chance that he can have in this
Hmm.
world."
Yeah.
But he's like, yesterday, he's like, I never would have asked for this. He's like, the amount of changes, his son is Nicholas, the amount of changes that Nicholas has seen from going through these programs. And, certain programs, certain breaks, certain
Yeah.
programs,
Yeah.
again, it's not like a constant 5 days a week for the last 3 years. It's,
Right.
we've done very deliberate protocols, but he's like, if you asked me when we first met if I wanted this, I would have said yes, but like it wasn't even an option in my mind. Like I
Yeah.
just wanted him. to have the best chance. He's now in accelerated programs doing better than other children with like completely normal behavioral patterns, completely normal social patterns. Like he's like he's like I want to keep going because I don't even know what's possible anymore,
Yeah.
but I can't believe that this is my son,
Yeah.
you
Oh,
know?
That's incredible.
yeah.
Um, there was this kid, I mean, we treated this one virtually, so like home chamber,
Yeah.
um, without oxygen. This kid, he was 3. Um, he couldn't go in the car. Like he'd go in the car, scream, no matter where they were going and how long. Like sit in the car, scream until we get wherever we're going. Sit in the
Yeah.
car, scream to wherever we're going back.
Wow.
3 years old, hadn't slept more than 25 minutes in a row
Oh my gosh.
his whole life. Like as a parent,
Wow.
imagine that. Forget that,
Yeah. Yeah.
I understand for the kid as well, but just
Yeah.
like
For every,
imagine that,
yeah.
imagine what these parents were like on these phone calls. I mean, they
Yeah.
were shredded.
Yeah.
This kid, so nonverbal, intense behavioral issues, intense, social issues, a lot of stimming, a lot of head banging, like really bad stuff. I remember when they got their chamber, the kid literally screamed for the whole first session.
Sure.
And they would call me like the mom was in the chamber with the kid, the dad's calling me like, "Are we okay? Is everything like?" I'm like, "We got to do the best we can, slow the pressure, do this." Like screamed,
Yeah.
hated the chamber. Like I
Yeah.
was like, "I man, maybe we made a mistake. Maybe it was too soon. I don't know." They get through the first session was awful. They call me the next day. It's like 10:30 the next day in the morning, and I see their phone number, and I'm like, "Oh my God, what happened?"
Yeah.
And I get on the phone and they're like, "Should we wake him up?" I'm
Wow.
like, I'm like, "What do you mean?" Like, well, he finally fell asleep in the chamber. We were able to depressurize. He stayed asleep. We put him in bed. He stayed asleep. It's now 10:30 in the morning. He's still sleeping. Should we wake him up? And I'm like, "Is he breathing?"
Yeah.
That's like, oh my
Yeah.
God, is he okay? They're
Yeah.
like, yes, like we keep checking on him. We're like deathly, we were afraid that he's breathing. He seems fine. I'm like, I wouldn't wake him up. This is
Yeah.
like the first time this kid slept in his whole life. I was like, you
Oh,
should go back to bed.
yeah.
Kid sleeps till like noon, wakes up, and they're like, he's a different kid. Like he's not screaming, he's not running around. That dinner, they call me. You're like, you're not going to believe this. Like, I'm like, he's never going to go back in the chamber. Like, that
Right.
was a terrible experience.
Right.
They call me after dinner and they FaceTime me and they're like, you're not going to believe this. And they turn the camera around and the kid literally like walked over to the chamber on his own and like jumped in.
Wow.
He's like, I know what sleep feels like now.
Yeah.
Like, at 3 years old,
Yeah. Oh,
So I'm like, not that every story are like these, but
right.
a lot of them are, and it's incredible to see something that was 1.3 air only.
Yeah.
That
Oh
was
my
like
gosh.
the lowest dose of hyperbaric we could have given this kid.
Yeah.
He didn't even get a full hour because he was screaming. We couldn't pressurize, like, and that was a couple years ago too. So like, this kid is also like not. He's actually in school,
Hmm.
kindergarten. He still has quite a few like additional special needs.
Sure.
So he's like in an adaptive program in school, but like can go to school, can handle school, has been sleeping like a freaking champion, is catching up on a lot of developmental milestones. So like
Wow.
the thing I say to parents all the time is this: Are you going to get everything that you want? I don't know.
Right.
Are you going to get all the things you want in the order that you wanted them in? I literally have no idea.
Yeah.
All I can tell you is I've never put anyone, even an adult, I've never put somebody in a hyperbaric chamber for a series of sessions and had nothing happen. That's never happened
Yeah.
in 20 years,
Yeah.
thousands of people. It's like changes always occur,
Yeah.
right? Maybe the first one you get is the one you think is least important. I'm sorry. I can't dictate that,
Yeah.
but I can tell you that there's no way nothing's gonna happen,
Right.
you know?
Wow.
Yeah. I mean, all those testimonials need to just be like screamed from the rooftops because if parents knew,
Right.
like, why not even try it? You know what I mean?
100% right.
Because something can change. And just like even in chiropractic, when patients ask, like, oh, like, your body dictates how it wants to heal. When you give it the ability to do so and you help provide the right resources and everything, like, you may be surprised what heals first versus something else, but it wants to be in homeostasis. Like, it's going to
But
do
the
its
body
thing.
wants to heal, right?
It does.
Like,
Yeah.
it's not like I've never healed a person in my life. I've been doing this for 20 years,
Yeah.
right?
Yeah.
Patients heal themselves. It's just getting the right ingredients. And turns out oxygen's a really important ingredient,
Yeah. Oh, I'm
and
love.
it's so it's underappreciated and it's
Mhm.
definitely underutilized.
Yeah. Well, loving this conversation, but I want to get to some of like just some questions that we had gotten along the way when people knew we were going to do this interview.
Sure.
So we'll run through those and then we'll be respectful of your time. So we definitely appreciate
Okay.
it. Um, as far as like the soft shell chamber goes, like we can kind of focus on that. Like what can the kids do in there? Like how would you keep them entertained? Like what do you see most often or what do you guys do in your office?
So we'll have like maybe a parent, you bring a book and so very
Yeah, for sure.
age dependent and cognitive ability dependent. So there's a lot there, but anything from reading them a story, coloring books, magnet tiles and puzzles and games. You know,
Yeah.
if we can make it useful, I'd love to make it useful. So like if we're dealing with brain issues as an
Yeah.
example, and we know which area of the brain is struggling, and then we can create an activity that would stimulate that area of the brain during the session. Now we're driving blood and driving oxygen and activating the thing we're trying to heal.
Yeah.
That's the best case scenario.
Yeah. Love that.
You know, I don't, we don't want electronics in the chamber.
Yeah, that was a
Um,
question. Like, can I
and
bring my cell phone?
I don't, yeah, like I don't, that's, I know people do it.
Hmm.
In the industry, it's generally accepted as not acceptable. Like no electronics, no battery operated devices in a chamber. Um, we went 20 years without any catastrophic hyperbaric accidents. Last year there were two.
Wow.
They were definitely at different pressures. One of them was definitely related to batteries in a chamber.
Wow.
So like for me, I just have no tolerance for electronics in chambers.
Sure.
But there's so many other things we can do, and then
Yeah.
to just use it as like a distracting tool, like why do that?
Hmm.
We had like we had this is just another recent one, but this family came to us. Daughter was the one we were treating. The dad was like, "We have to bring an iPad. Like, we have to bring an iPad." I'm like, "No, sorry. Like, we don't. Well, then we're not going to come here." And I'm like, "Okay. Like,
Yeah.
I don't know what to tell you." But the reason you can't is a safety thing. So if
Yeah.
you go somewhere else and they let you do that, just recognize that you're changing the risk assessment for your daughter.
Yeah.
So do what you want, but understand that like this isn't like I'm mean and somebody else will be nice to you. It's like I'm trying to keep you safe and potentially somebody else is putting you at risk.
Yeah.
So if that's what you want to do, go do it.
Yeah.
Anyway, he decides to come in. Um, and he's like, I mean, what can my daughter do? And so we're like, coloring books, like we have a bunch of stuff in the office for these kids. Well, I don't know that I don't think my daughter knows how to do that, or I don't even think she can do that. I'm like, okay, well, try.
Yeah, maybe she'll
So
learn.
they go in. What's that?
I said maybe she'll learn, you know.
Well, so sure enough, they go in. She starts coloring, and she's just like, not not coloring in the line. She's just like,
Yeah.
but she's having fun. She then gets a blank piece of paper and like starts to draw the chamber that she's sitting in
Oh,
with her and her dad sitting there. Like a level of comprehension of like her environment. He got out of the chamber. He's like, I had no idea that she would even understand what we were doing.
yeah.
Like to watch her draw this picture of her current like exposure was me seeing her understanding her environment in a way that I didn't think she could comprehend. It
Mm,
like it forever changed his outlook on what she's going through,
yeah.
And it's like you got to give these kids a chance to express themselves in different ways and crazy stuff happens.
Yeah.
That's all I can
Yeah.
say.
No, that's so cool.
Yeah. And I think too, like give them the option to like learn how to be creative because obviously we're so technology dependent anyway. So,
Exactly.
what age do you typically allow kiddos to go in by themselves?
I wouldn't say it's even an age only issue. It's more of like a responsibility issue.
Hmm.
Like, can they equalize or not on their own? Do they need any support like that? Can they occupy themselves on their own, or do they
Yeah.
need entertainment, so to
Yeah.
speak? And can I trust them not to push the buttons and turn the handles and do all of that?
Yeah.
Um, so it really does vary. Obvious. I mean, I'm
Okay.
sure you see this. I hate to even say these generalities, but like
Yeah.
boys tend to be more curious that way than girls.
Oh, yeah.
Um, so that there's a gender difference, I think, in terms of like, what does this do? And what does
Yeah.
this do? I'll
Oh, yeah.
turn this and just see what happens. I
Oh,
mean,
yeah.
but like, 8 to 10 years old in many cases is kind of, somewhere around there. Less like younger, less likely, older, just from a maturity standpoint.
Sure. Sure. Awesome. Well, I love this. This is so good. Before I let you go, tell our listeners where they can listen more from you or get more information, and if they did want to get in contact with you in regards to like, is this a right avenue for themselves or for their kiddos? How do they contact you?
Sure. So if you just want to learn more about hyperbaric, what it is, what it does, and if it's even remotely the right option for you, I'd probably say the YouTube channel is the best place to go. So
Cool.
HBOT USA is like a YouTube channel. I think I have like 750, 60 videos on there.
Cool.
Almost any topic you could think of, I've probably has come out of my mouth at some point. So it's free. There's a lot of information, and I would encourage a journey to start with something like that.
Yeah.
HBOTUSA.com is like our main website. We don't sell anything there either. It's just information about hyperbaric oxygen and ways to understand better if it's a good fit or not. Um, if you wanted to contact us directly, you can either contact us through hbotusa.com or drjasonsaunders.com. Either way. On drjasonsaunders.com, I also have other like articles I've written or there's just additional information that's a little outside of like hyperbaric only.
Cool.
But yeah, I mean, 100% feel free to reach out to us, shoot us an email. If we're the right fit, that's great. If not, we can point you in a direction. HBOTUSA.com also has like a locations page.
Cool.
Not everybody, I mean, we've trained over 1,000 different practitioners and technicians. Not everybody we've trained is on that list, but people that we've trained that we work very closely with, that I trust completely,
Yeah.
are on that locations page. So if you're
Okay.
looking for a location, that's another great place to go.
Yeah, I love that. When we know they're trusted. And I'm with the
Right.
training too. Do the people with the training, do they have to continually like renew a certification
Like
or something
there's
like
like a
that? Yeah.
annual renewal,
Yeah.
with just like a little
Yeah.
continuing education and stuff like that. Yeah.
Yeah. I think it's important, just to stay up to date and what's going on. And then, like if someone does find someone on your website, they know that they're doing the research and they're doing the right protocols and treatments.
Exactly.
Beautiful.
Exactly.
Well, thank you so much.
You're quite welcome. Great chatting with you guys. I appreciate you having me on.
Dr. Sunners, thank you. You've given this community something really concrete to hold on to. The idea that the body is resilient, that labels don't dictate what is possible, that it is something every parent in the middle of a hard season needs woven into their bones. We will link everything he shared in the show notes. Thank you for your time. What Dr. Sunners said about labels, I want you to stay there for a second, because a lot of us in this community have been handed a label, a diagnosis, a prognosis, a statistic, and sometimes the medical system, without meaning to, makes that label feel like a ceiling, and it's not. Our bodies know how to heal. Your child's body knows how to heal, and your job, the job you are already doing by listening to something like this, is to figure out what that body needs and put it in front of them. If hyperbaric oxygen is something you want to explore, we've linked both of Dr. Sunners' websites in the show notes. Go learn, ask the questions, and if you try it and have a story, I want to hear it. Until next time, you are held, you are not alone, and you were born for this. If this episode resonated with you, we'd love for you to take one simple step. Share it with a friend, another parent, or a caregiver who might need to know they are not alone in this journey. Make sure you are subscribed so you will never miss an episode. We release new stories every Monday. And if you're looking for more connection, resources, or ways to share your own story, come join us on Instagram at borntforthisstories, or visit our website at borntforthisstories.com. Remember, whatever part of the journey you're in, the waiting room, the recovery, or the in-between, you do not have to carry it alone. We see you, we stand with you, and never forget, you were born for this.